Welcome, everyone. It is 9 o'clock, so we'll go ahead and get started. People will continue to join, and that is just fine. I'm Christy Ganya. I'm a program manager for Telehealth Rocks. And Telehealth Rocks is a federally funded program that focuses on school-based behavioral health, and we do this by working on social determinants, supporting school-based services, and telementoring trainings just like this one. In addition to our speakers, we have some Telehealth Rocks team members here today. Sage Brown, Chase Koob, and Haley Bell are here to help. They might be putting items in the chat or responding to questions or chiming in during the session. Feel free to reach out to any of us if you need something. So we do have just a couple of reminders for you. This session is being recorded and we will send it to you afterward. Just give us a little bit of time to process the recording. Your microphones have been muted, but please feel free to unmute or type your questions in the chat. And then it's very helpful if you can make sure your first and last name are visible on your Zoom screen. That way we can track attendance. You can also type your name into the chat. All right, we don't have any disclosures and everything presented today is evidence-based and currently accepted within the profession. Just a few notes for after the session. We'll share the slides and recording just as soon as we can. Those will go out via email to you. And then certificates of attendance will be emailed after this session for the October through December attendance. So those will be emailed out to you in the next week or so. And then please feel free to send any questions that you didn't get answered to our Telehealth Rocks email. And then I will hand it to Evelyn and Robert to get started today.
Thanks, Christy. Welcome, everyone. Great to see you back here at the Social Determinants of Health Echo series. Next slide, please. We'd like to start off today hearing from you all and getting some ideas from our last session where we talked about healthcare access and quality. A lot of the focus of that session was on communication between partners and ideas about advancing social determinants of health through partnership. So we'd love to hear in the chat things that you may have put into practice or tried to start putting into practice. Really hearing in the chat if there's any lessons learned about what helped or got in the way of putting a socially determinant of health goal into practice. It looks like we're all still getting going here first in the morning, so we'll leave this question open in the chat as we go through the series today. We'd love to hear from you. Partly this slide is just my own reminder as we hear the great information from our partners and speakers today. If kind of thinking ahead of setting a social determinants of health goal around education and hearing from you the next session about what may be put into practice. Next slide, please. So things that we'd like to cover today, we're going to review the Healthy People 2030 education domain around social determinants of health. We're going to share pathways of education's impact on health. We're going to talk a little bit about how school partnerships impact the health needs of communities. And really fortunate to have Monica Murnan and Leia Holley with us today to share some of their work putting things into practice and how that has looked in their community. And then finally, we'll finish the session today with encouraging goal setting and continuous improvement. Next slide, please.
So just a reminder, I know many of you have been with us and we had an introductory webinar where we kind of really talked in general about the social determinants of health. And then we have covered one and are covering the second today. So we've covered healthcare access and quality and talked about school-based health centers and why communities and schools have come together on that. And then today we're really going to talk more about education, access, and quality and kind of reverse the script a little bit and talk a little bit about how education, access, and quality leads to better health. So just some examples of how social determinants or what they are is things like your income and your education level, and especially relationships and social connections, which that's one that we often don't think about, but it's incredibly important to having a healthy life. Christy, next slide, please.
So as Robert mentioned, throughout the series, we'll cover the five areas of social determinants of health. So today we're focused in on education access and quality. So the factors related to education and how well it supports your individual learning needs. It was kind of it struck me that we just wrapped up our brain work series and looking at brain health. So, in preparing today, just a lot of thinking about education and access and quality, really overlapping some of what we talked about with brain health and brain works, and just seeing how the two things go together. It just kind of keeping that in mind as we go through the information today. Um, as Robert mentioned too, none of these are in siloed. All of the different five areas of social determinants impact the other. Today is more an area of focus, so focusing in on education, but understanding all five areas are always impacting one another. Next slide, please.
So we're not here to promote anyone, but Cleveland Clinic has a really great website on the social determinants. And for each of them, they kind of have come up with a series of questions. And I just think these are really important questions, whether you work on the school side or the community side. When you think about access and quality, it's things like, does every kid in your community have access to a high quality K through 12 education? Does everybody have the opportunity to finish high school? Does the education, are their education needs met? Including those that have specific needs related to things like learning disabilities or intellectual disabilities. Is every child able to go into college and career? Are they able to have a path into a successful economic and family life? And then does each child have the opportunity to have positive relationships at school and in their life? So next slide, please.
This slide is really saying the same thing that Robert just shared, but more in some of the public health vantage point. So looking at Healthy People 2030 and the education and quality and access social determinant of health domain. The goal is really to increase educational opportunities and help children and adolescents do well in school. So when I look at the participants joining us today, we really have lots of different roles looking at how we can increase educational opportunities and help children and adolescents and families too. Um, Really thinking about it, it may be our work role, it may be our parent and family role, it may be our community role, but all those different roles really impact this overarching goal of increasing educational opportunities. With Healthy People 2030, we really see it's a broad scope. So with this domain, it's looking at educational and school-based programs to address needs, including school readiness, engagement, achievement, and completion. Next slide, please. And this is, I know those of you have joined us with the other session. We talked a little bit about this model already. It just is such a nice visual, I think, that talks about how education and health go hand in hand. Um, and so, really thinking about as you influence one thing, you're almost always influencing the other. Um, there's lots of different ideas on what pathways kind of go make that possible where education and health are always influencing the other. And you'll see some of those on the slide. It may be related to income and resources, social and psychological benefits, healthy behaviors, and healthier or neighborhoods. Um, this slide is also kind of our reminder slide that everything's kind of within the ecological framework and always influenced by the context. So things like social policies, individual and family characteristics, all those are kind of in the constant background influencing both education and health. Next slide, please. When we were thinking today about social determinants of health, there's a similar model where it just flips it a little bit and looks at social determinants of education. Um, and so what you see is it's really all the same things that we see with social determinants of health are influencing the social determinants of education. There's a really strong body of literature and research that are really persuasive that learning is shaped by all of these factors. I know this isn't new news. I think we all live this in our daily life, but it is kind of saying that we also know that really is also what we see in the research, that learning shaped by our social and community context, by economic stability, by our neighborhood and built environments, which I know we'll hear more about that coming up in January. Um, it's shaped by the things we're talking about today with education access and quality, by what we heard last session with healthcare access and quality. Again, really seeing how all those factors fit together. There's another concept that's called social determinants of learning, which is really similar to social determinants of education. Social determinants of learning, it's a concept more used in higher education, but it's really talking about these same learning factors, just kind of more focused on higher ed. Next slide, please. And then this slide really brings home why we're talking about not just today, but this whole series, just really seeing the impact that education has on health. Um, I know we've shared some of these really compelling CDC facts about impacts of education across health, behavioral health, and substance use. Um, Even taking that a little further with this session today, um, it's really striking how much higher educational attainment is associated with better health outcomes in almost every health condition, not just health outcomes, but health behaviors. So, kind of thinking about the course of the lifespan, higher educational attainment, or completing high school and those educational attainments, it goes along with infant mortality. So higher education goes along with less infant mortality. Higher educational attainment, as we look through early childhood and into the school years, it goes along with almost every child health condition. So things like allergy, asthma, some of those common conditions with higher educational attainment, we see that those conditions are impacted by that. And then going into the more adult years, almost every chronic condition, diabetes, obesity, all of those, we see that with higher educational attainment, there's better outcome and less risk around those health conditions. And even in older adults, where we see that um, with Alzheimer's and other dementias, that with higher educational attainment, you see less risk and better outcomes. So all this is to say that education and academics, it's really strong medicine. It's really amazing the impact that education and educational attainment can have on positive health outcomes. Um, Further, there's some really new research that came out this year, again, reinforcing this, that education shows a dose response relationship with all cause mortality. So, really looking at with higher educational attainment, there's there's greater longevity. So it's just a really powerful connection between health and education. And then finally, the quality and length of one's education impacts our students' future well-being, employment, and economic factors. Next slide, please.
So when we think about education and how it impacts health, we really see that family, school, and community partnerships really play a role. One of the things that we feel really fortunate in working with school districts and also working across communities and across state governments and even the federal government is that we know that communities and schools understand that the well-being of our kids is the well-being of their community. I've been talking a lot lately about economic development and that kids being healthy and having strong education and being prepared for careers and life means we have strong communities because then we have people that are starting businesses and working at businesses and being successful and making our communities successful. So the CDC has a model called the whole school, whole family, whole child, and I always get the order wrong, um, approach, which really thinks about all the different ways that we can lead to having healthy and successful kids. And you can see there how school and family and community can really work together. Next slide, please. So one of the things that I found really interesting is people sometimes think telehealth rocks and the work that we do in local communities and local school districts is really somehow remarkable or special. And what's funny about it is it's really not because the community wants to help our kids. The community wants to be involved in schools. And one of the biggest questions I tend to get from the community is, how can I help my school? How can I engage my school? How can I be part of the success of the kids in our community? And it's so interesting because when you talk to schools, they often say, how can I get my community to help us and to be part of the solution? That schools are not the only thing that should be impacting kids' ability to be successful and the success in life that they have and how it leads to the success of our community. So this is just one way to think about it or look at it. But the truth of the matter is we've all got to work together, right? Kids are all of our responsibility because kids are our future, and kids' educational success is the educational and economic success of our community, of our state, and of our country. Next slide, please.
Another area where we really see the impact of social determinants on education is attendance. So this slide is really speaking to attendance, or really, I think about it as dose in school. So the amount of school is really part of the strong medicine we were talking about before, where being in school, it helps with outcomes that we see in the immediate, where in elementary school, you see attendance goes along with improved reading, math, and foundational skills. In middle school, you see a strong connection with attendance and development of relationship and communication skills. In high school, you see that attendance goes along with gaining life skills that are going to carry beyond graduation and continuing into college and the work world, where attendance in school, it really sets up children for success in their future jobs and their degrees and all of that. And ultimately, it also goes along with socioeconomic outcomes. Um, we see that with youth, from kindergarten through graduation, that's about 14,000 hours of time. And really seeing that with that time, if we have children in school, what positive outcomes we see. I think with that, we see that addressing social determinants of health needs really has a compelling impact on being able to attend. I know we have several community health workers and other folks who really work at addressing social determinants of health needs, and just seeing the positive impact that can have on attendance. Next slide, please. And so we're really fortunate today to have a couple of partners sharing their experience around the education social determinants of health. We're fortunate to kind of hear and learn from that story. We're really hoping that kind of hearing that it helps spark ideas and innovations as we all think about how to move the bar and improve social determinants of health. Next slide, please.
Well, and I get the benefit and the fortunateness of introducing our two panelists today and talking with them a little bit. I just want to start by saying, we have an abundance of resources. Most of you could have been a panelist today. We're so fortunate to work with such strong people that are so committed to education, quality, and access. So Monica Murnan, who's the Director of Community Support Services with Southeast Kansas Education Service Center, Greenbush, as well as Leia Holley with Families Together are going to join us, are with us today. And please, I hope everyone will feel open and free to put questions in the chat as we talk and as things come up or questions that they might have. But I'm going to start by going to the next slide and kind of talking about some basic questions that might help begin the conversation. So the first one really is to kind of get to know Monica and Leia. I know many people know both of them. And so starting with Monica, I just wonder if you could tell us a little bit about Southeast Kansas Education Service Center Greenbush and kind of how it started and especially kind of what was the impetus to really focus on how does it help with education access and quality?
Hi, everybody. It is so fun to look through the list of names. Like, I know so many folks on this call or where you work, and I'm not sure that I have any more expertise than anybody else on this call. I probably just have been to more meetings. So that that is my claim to fame here. When I think about, I've had two really great experiences in work, and the one that I'm currently experiencing is with Greenbush. It looks like on the call many of you are familiar with the concept of Greenbush, which is an old concept of cooperatives, like an old grain cooperative or a collaborative or a water district, those kind of things, but started in the 70s when that became a thing in the state of Kansas to be able to support small school districts in the southeast part of the state. What has grown now into 500 employees all over the state doing the traditional work that we've always done, which was getting technology to small school districts and getting purchasing stuff with and for small school districts. And finally, providing professional development to the adults who work with kids. We still do all those things, but we have added a whole wing of things that would fit more in this category of home. We have a lot of home visitor programs. We employ a lot of home visitors across the state and provide the infrastructure and support to do that. And then we also have, for years and years, worked with state agencies, specifically the Kansas Department of Aging and Disability Services, as they provide services at the local level. And our major function has been how to measure things that we know now are social determinants of health. Back then, we called them benchmarks and indicators, but how to measure those pieces of data so that good decisions could be made about funding and where resources go. So we have done that for a long, long time. Another interesting piece that fits into this conversation at Greenbush is for going to be 30 years pretty soon. We have administered the Kansas Communities That Care survey, which was one of the original concepts that came into play in Kansas out of Washington State back in the day that said, hey, we probably should talk to kids, see how they're doing. We would now say we're measuring preventative types of things about high risk behaviors. And guess what? All the things that Robert listed in here are taken into account in that data collection each year. So lots of things that would be considered direct service, as well as things that are a little more ancillary, but contribute to that. So I get to work in lots of different fields now in this area. Most of you on this call know me as an early childhood person, and that's what will be the headliner in my obituary. But right now I'm really focusing on systems, as we are at Greenbush, because we have the infrastructure and framework to assist others in this work.
Well, Monica, I'm so excited that we're going to get into some of your background and what drives you in a second, but because there's so much. And I would say just have to reiterate that in trying to think of who can talk about education access and quality, we are so fortunate in Kansas and Missouri to have such an extensive list of people that do such amazing things. And so, it's really wonderful to see all the innovative and just really successful and excited and committed and dedicated people when it comes to this area. But Leah, tell us a little bit about Families Together Incorporated and kind of where it comes from and kind of, what the focus is or why it exists.
Wow, that's hard to follow, Monica. And I mean, I looked at the list of people and I'm just kind of overwhelmed by the expertise and the passion that I see in the people who are attending today. And I know many of you may know about Families Together, but there are always, we're kind of that hidden gem. Families Together is Kansas's federally designated parent training and information center and family to family information center. We support families and their children who have disabilities or special health care needs. That's mental health, that's trauma, that's anything from autism to cerebral palsy to ADHD to cancer, birth through ages 26. And I had a parent once tell me that we're the one-stop shop. We're where families can turn when their child is struggling. And we're here to assist families, whether they're just starting out or they've got a new challenge along the way. We provide assistance with early intervention, education, healthcare, transition, and community resources so that the families have the support, the academic, behavioral, social, emotional, and well-being of their child and family. We some of the services we provide, one, they're free to families who include a child with a disability. We assist families along that journey educationally. We provide one-to-one support. A family picks up the phone, they call us, and we are there to assist them. We have staff. All of our staff have a family connection with an individual with a disability. It's safe and confidential. And we help them navigate those complex systems. We work with parents or legal guardians, but we also work with families or youth. We've got some amazing programs going on working with youth because we can help families or parents, but if we're not addressing the needs of social, emotional, and academic needs of youth, then we're not moving the needle like we need to. And we have offices in Wichita and Topeka. Those are our two main offices. We just opened an office in Kansas City. We have individuals in Fort Scott, a staff member working remotely in Fort Scott, Garden City. Oh my goodness, it's going to escape me. It'll come to me in a minute, but we have staff working remotely across the state, and we do serve families across the state. It's a lot of what we do is virtual. So, as a Families Together was there for me, and I wish I could give you a better description of what Families Together does, but we do it all basically. We're that place that families with kids with disabilities pick up that phone, they call us. And most of our programs, our families call us and then we will support them. We have a program that works specifically with justice involved youth in Johnson County and their families. In the Southeast Kansas, we have thanks to Telehealth Rocks and Robert, we have funding to assist youth who are, whether they're foster care, whether they're struggling academically, or they're in the justice system, where we can work individually with those youth. We have a program called FAST that works with families who are at risk of losing their kid to foster care. We assign education advocates to support young people who do not have legal education decision makers. So we have a lot of stuff happening in Families Together. So you have a family with a child with a disability, you have them call us or email us, and we are going to be there to assist them. Robert?
So I'm really interested and kind of go with both of you. I'm going to start with Monica. Both of you have spent your entire careers focused on this idea that every child should have access to the education and the resources that they need. So really, Monica, you've had such a wonderful career. I always say that people wonder where I'm going to show up next, and Monica's always wherever the things are going on that need to happen in the state, and really helping to move things forward in the state of Kansas to make it a state that works for every kid. So you previously worked, and when I first got to know you, which I think is probably 20 years ago, and it was probably that you called me to tell me something that needed to happen, and you were right.
I probably gave you a list of things to do
Yes.
to make sure it happened.
And Monica is so wonderful because you're willing to stand up and say, hey, these things need attention, and to really push and drive. And so I'm really interested because you helped to start, you were involved in starting the Family Resource Center. And I think a lot of people want to hear about that, as well as just sort of what was going on in Pittsburgh that led to the creation of that, and what is it for those who might not know?
Yeah. Thanks, Robert. So I'm changing what I was planning on saying based on the people who are on this call. To put this in context, in 1995, and yeah, that was a long stinking time ago, there was this gal and this guy. The gal's name was Krista Postai, and the guy's name was Dan Nineswander. And he was superintendent of schools, and she was vice president of our hospital, which at the time was run by Via Christi, Sister St. Joseph. And both of them had a charismatic as well as visionary attitude. They also both held in their heart a strong sense of social justice and recognizing that education and access to healthcare are equalizers. And when you live and work in an area that has cyclical demographics, that we just kind of keep running around the demographics, you all know what I mean. They said, hey, we need to do this thing. We need to have an early childhood center. But we want to do, in addition to childcare and pre-K and the kind of standard things, even though they weren't standard in 1995, we have to have a health component in here, and we have to have every community partner under the sun. We also have to recognize that in a town with a university, we have to pull all those things together. And they did that. And created a nonprofit. And then I stumbled in early on, and they gave me a list of things to do and paid me $20,000 a year. I was a hard little worker. The list of things to do, this is why I'm changing what I was going to say. One of the beautiful slides that Evelyn showed earlier, or maybe it was Robert, and it was a lovely, wheel spoke kind of thing. That was the list. I could take everything from the original list that those folks envisioned and put it in one of those spokes and holes. And we just started doing them. We started doing them 2 years later, opened the second largest childcare center in the state of Kansas with 14 agencies and organizations working together, and no stinking clue what I was doing on a daily basis. No stinking clue. Just went every day and said, okay, what seems to be the right thing to do for kids and families? At that time, putting in healthcare access within a center that had 250 kids each day under the age of 5 in it seemed odd. There were a lot of conversations about, is this wise? Are you going to come down and, just go ahead and give the kids immunizations? Are you just going to do it without asking their parents? The same questions we have now. Cassie's smiling. Yes, in a school-based health center, we are going to hand all the children birth control. That's going to be the first thing we do every morning, right? And you just kind of bang your head up against the wall, right? But here's the deal. That group of people who couldn't understand the concept of mixing and mingling, which we now call social determinants of health, were small. They were just loud, and they had control of the resources and the money. When we started listening to families and to people in the field and unheard families, right? Unheard families, we knew we were on the right track, and we knew that we had to keep going, and we knew it was hard every day. And I see Pamela on the call, And when somebody said, what about all these kids with really, really extreme behaviors? And what about all these kids, these kids that we used to keep over here, right? Well, guess what? All those kids have hearing issues, every kid that I have talked about, because their ears get stuffy. When their ears get stuffy and they can't hear, guess what? Their language becomes delayed. Their language becomes delayed, and they're 3 and they're 4. Guess what they do? They bite, lick, and slobber on their friends because they can't get across what they want and need. So that very simple explanation of hearing and language development is the thing that I continue to say all these years later, because that helps people understand what we're talking about. When we talk about health and social determinants of health, and that using that phrase, we lose a lot of educators. We lose a lot of people in positions who make decisions about money and resources. But when we connect with simple examples like that, people go, well, sure. Oh my goodness, my grandchild just started talking immediately when they got tubes in. Right. And I want to share with all of you that those simple ideas are still a great way to help people understand what we're talking about. You guys get it, you all get it, but the simple examples are still true. I'm looking at Angie Hadley on here, the work that Angie does with truancy diversion. What we know for sure is a big connection is access to appropriate behavioral health and healthcare, and consistent, right? And it's just on truancy kinds of things. And I just really think that one of the messages I want to share with you from my war stories of starting the center and then starting Community Health Center of Southeast Kansas is that it really is about 3 things when we talk about this concept. One is removing barriers, and barriers aren't always money. The second is about building a bridge somewhere. And if you can't get the bridge built, if you could at least throw a ladder over so that you can walk and pull the ladder back out, when you're done, whatever it takes to make that connection. And the third thing is recognizing where there are holes and then keeping those lists of holes open, right? Like, we need to always be talking about where is the hole in this, in this quest to have access. So I'm going to end my walk down memory lane with, well, Community Health Center Southeast Kansas. Think about half of you on here, maybe get your paycheck from there. When we started community health, I'm going to tell you, this is a true story. It's about access, barriers, and holes. We had a clinic that was part of the hospital, and we were doing things like immunizations, because we were doing stupid things in Pittsburgh, like kicking kids out of kindergarten because they didn't have their immunization. Let's stop and think about that for a moment. That's a great idea. A kid who already is behind on immunizations and such, we're going to expel them until they get them. Let's just keep them. That'll show them, won't it? And that superintendent who said at the time, he brought me a list and he said, none of these kids are going to get kicked out, and you're going to make sure of it. So we started doing things like vaccines. 2 years later, we incorporated and started Community Health Center of Southeast Kansas, and it didn't take off because it's hard. All these things about connecting education and healthcare are hard. They are still hard today. But when you get phone calls that say, I'm a grandma, I'm taking care of my grandchild, she's 4 and I need Insure. And I said, why, I used to work at a rest home. We gave Insure to, her teeth are so rotten, she can't eat without pain. Well, have you tried to get the teeth fixed? Well, yeah, but nobody will take her Medicaid. Enter Community Health Center, and a bunch of smart people and a bunch of people who gave a dang and weren't scared to say, I'm just going to ask one more question. And there you go. So when we think about this concept and we throw around these phrases, I just like to encourage folks on the call to learn from a haggard old gal. Sometimes just keeping the examples simple will help us move our cause forward.
And I think that's such an important thing to say. I don't care what words we use. I often talk about food, clothing, and housing, right? But I don't need a big fancy word. I don't, and I'm not going to argue about what the word of the moment is either.
Yeah.
But we can talk about, we know that a child that is unhealthy, that doesn't have their healthcare needs met, that is at school sick, is at school with a hearing loss or any of these things is not going to learn. But I'm also a big believer that nothing belongs in a school unless it's about education. But all of these things are about education because they're about how, it's not a teacher's job to have to worry that the kids in their classroom don't have food. How can they learn without food? We've got to start working on all of the issues that allow a child to learn. And that's really about the health of our communities because those kids become the residents of our communities and they become the people that we need in jobs. And I've just been really hitting hard on this idea that the success of our kids and the success of our schools and our kids' educational attainment is about the success of our communities. And I wanted to bring in Leah and really, I think there's so much to learn from. These are two of our education leaders in Kansas, among many people who are on the call who are also education leaders. But tell us a little bit about what led you to work with families together. I know you referenced a little bit about, having a child that related you to the work and families together.
Robert, first, I wanted to say thank you for including the family perspective. So many times we lose that perspective, or it's kind of glanced over or token. And I really appreciate you making this an important part of this discussion. When I, s- I when I was younger, lots younger, I was a high school math teacher, and I had kids in a classroom from 14 to 21 teaching basic math. And I didn't know how to teach them. I didn't have any special ed background. I'm standing in the hallway with another teacher, and I said, I can't teach these kids. I don't know how to do it. And she said, don't worry about it. They're in special ed. And I looked at her and I said, why are they in my class? I did not know how to teach them. I did not know how to support them. Those kids with more complex needs were in the basement, hidden, and I had substituted in those classrooms. So that was my first experience with really disability or special education. And then my son, Sean, at 2 years old, he had regressed and lost skills. So we take him to his doctor the whole journey. We're told from a neurologist that he will never speak, never have eye contact, never be a functioning member of our family, prepare to put him in an institution. He's severely autistic. I promised him at that moment he would never be one of those kids. He would never be in the basement. He would always be a part of his community and his family. So the infant and toddler gave me a binder. That tells you how long ago it was. They gave me a binder full of phone numbers. I called every phone number in it. I got the answers of, you make too much money, you don't make enough money, you live in the wrong county, you're too old, too young, wrong number. When I got to the number for families together, I can still hear Bonnie Penny's voice on the other end of the line saying, you're not alone. And I'm saying, you don't understand. He has autism. He's the only one. Sean's 32. Back then, autism was the Rain Man, and that wasn't Sean. And so I'm isolated, military family living on Milford Lake. I've called families together, and my that voice, Bonnie's like, yeah, I know another mom who does kid does similar things. And so we talk, and I end up talking to this other parent through the parent to parent program. But those two conversations moved us. I had literally closed our door and had not left the house. Sean's behaviors were so significant, people were judging me. And so everything that was happening in our community, I couldn't access because of his behavior and the community not understanding his disability and thinking I was a bad parent. And so that phone call with Families Together moved us from an autistic family to a family who just happened to have some unique needs. And we talked about what the fun things he did, the strengths he did, and they brought us back to him as a person, not as a disability. So many times when you have a child with a disability, the focus is on what they can't do. We live in the medical model, guys, and families are stuck in this medical model, focusing on, I got to tell you what he can't do, what he did wrong, how many times he hit his head, he can't tell me this. Rarely do people ask, what are his strengths, interests, and passions? And Families Together was there through our journey. We did a lot of person-centered planning, a lot of help me understand my rights in the special education process. And along our journey, they helped us navigate the health care. Sean's in a military hospital on the edge of dying because he has pancreatitis and other things. They don't know how to treat him. Families Together says, hey, Leah, you can advocate and tell them to move him to another hospital. So they helped us all throughout the journey. Sean now has a job. He does everything everybody said he wouldn't do. And the community celebrates his quirkiness. He can walk around, be in the community, and what professionals call verbal stemming, we call singing. He can do one of his verbal stems, and from the time he was little, we would say, Sean, what are you singing today? So now we can be in the community, and somebody will he'll let out one of his songs, and somebody will come around the corner and say, Sean, I like that song, bud, let's sing it. And so they're not treating him differently, they're celebrating those quirkiness. And so for me, what led me to Families Together was the fact that they were there for me, helping me navigate all of these systems, helping me not feel isolated. I wasn't alone, because it is isolating to have a child with a disability. And throughout that journey, I also have mental health challenges. And we have to acknowledge that our families are struggling with some of these health needs as well. So, Robert, basically, Families Together was there when we started our journey. And they've been there throughout that journey. And I've had the privilege of walking alongside families for 20 years now as part of Families Together. And our staff, a lot of our staff have been there 20 years or more. We've got a whole bunch of new young bloods there too. But there's a passion and an energy, that the belief that families can raise these kids, can be important members of their communities and valued parts of their communities. And so to borrow from Brad, who leads our Chase program, is for us, Families Together helped us connect with the community. They helped us learn to communicate effectively. They helped us think outside the box and be creative with how we help Sean. And then they helped us connect with the community, understand that Sean needed to be a part of that community. They empowered us, they educated us, and they encouraged us. And so that's the goal for all families. And to know that when they pick up the phone, they're going to get somebody like me who has walked a similar journey.
So we have about 5 minutes left of this conversation, and then we'll be finishing up. And I hope if people have questions, please put them in the chat. But I think a lot of what we've talked about today with both of you really comes into this idea of, you both have seen how having a partner, both in the community as well as in the school, has mattered. So as people are thinking about how do we better support our students, how do we better support our families and increase education access and quality, what do you think is most important to create family and community partnerships to support students and their families? I'm going to start with Monica, and then I'll let Leah finish this out on these questions.
Yeah, I'll keep it short here because I think about this a lot. Number one, I believe that oftentimes those of us who are in the helping field get really worried about our forms. And you're like, forms? Did she just say forms? I did just say forms. I think we get so worried about intake processes and getting people in the right lane, in the right category. We need to think about basic human connections. Number two, I think we also really need to always have a self-check of, this family doesn't look like my family, and that is okay. Right? Good, bad, or indifferent, it is okay. We have to stop comparing families to our own or to what we think is the best. We have to stop doing that. And I think the cool kid way to say it is meeting people where they are. The other third thing that I would put out here is we really need to get out of the event mode of thinking in helping agencies. If I go to one more meeting about, we're going to hold a family fair, or we're going to have a make it and take it night, or whatever it is, think about your own family's connection with events. You may come from a family that never went anywhere in the evening times, or you couldn't go anywhere in the evening time, whatever it is. But I would say moving having events on a continuum, but considering that event-based engagement is not always the best. I don't have this figured out, friends. I'm responsible for a Parents as Teachers consortium that is very large. And every day I wake up and think, are we relevant? Do we have things that people want? I know we have good humans doing the work, but are we relevant? So I'm not going to say I'm an expert on it, but those are the things on the top of my mind.
And Leah, and I appreciate what Monica says, and I think it is so crucial. And I'm especially interested in your feedback as a parent who struggled and finally stumbled upon someone to help. When we think about the variety of services, one of the things, and Monica's not the only one who says controversial things. One of the things that I like to say is there's enough resources. The problem isn't resources. The problem is they're not connected. Our families and our schools don't have access to them. Like I said when we began, if I hear schools tell me constantly, how do I get the community engaged? And I hear communities constantly telling me, how do I get the school to talk to me? But when thinking about a family and the work that you do, what do you think is important across school, family, and community to get them all on the same page, or at least understanding how to work together or to support those families and those students that have needs?
No, Robert, I think it's a huge challenge. And for me, it's moving away from just telling parents what their kid does wrong. Build that relationship with the family by focusing on that, not only that child's strengths, interests, and passions, but what that parent's strengths, interests, and passions are, and engage that family in that way. For us, it was helping us see that our child with these significant behaviors had some amazing strengths, and how do we turn these quirky behaviors into things that can be celebrated versus a negative. And to Monica's point of events, you have to remember these families are struggling to navigate all of these systems. And I love the community health workers. If we had community health workers everywhere and what they do to help families navigate, because I've got families who have justice involved youth who are navigating at least 12 different systems. And we've got grandmothers raising their grandkids with disabilities, or great grandmothers raising their kids. Families look different. And we have to acknowledge that that's okay. And we have to stop assuming because a parent is not engaged that's because they don't care. We don't know if that parent's not engaged because there's a mental health problem, or if there's other things happening within that family. Or I'm exhausted. When Sean hit transition age, I'm exhausted. I have navigated so many systems, and just having somebody acknowledge what I've done as a parent and how, I mean, I'm telling you, when I talk to a parent and I say, you're doing a great job, I'm really excited that you did this. The mom says, nobody's ever told me that. Nobody tells parents that they did it. And I don't care if it's the fact that he gave her high five. You've got to get back to people. Robert's right. We've got resources, we've got systems, but we've lost sight of people and what the value of each individual person brings to our community. And bringing in, letting families like Sean transitioning to adulthood, telling me, hey, we need your help finding places for him to do community-based work. There's a therapeutic riding center, and he wanted to work with horses. So I went to the therapeutic riding center because the school said, hey, we need your help. Can you help us with this? But they did it in a way that wasn't, we can't do this unless you do this. They said, we're a team. Let's work as a team.
Thank you guys so much. I could talk to you all day. I did want to say something, Krista Postai's name. She was one of our last presenters and Community Health Center, and Krista came up today. One of the things that people, when they marvel at that clinic, that is basic to that clinic is the idea that there's no wrong door. And I wish we had a no wrong door to education. I know your organization may not be the organization that does that thing, but if you're a cleaning person at Community Health Center, you have as much power as anyone else, but you're also totally empowered to leave what you're doing if a patient walks in the door and get them to the right place. And Leah, thank you for bringing up CHWs. I think that's a way to put someone on the side of the patient to say, you know what, we're going to look at all the doors until we find the right one. And then we're going to get you through that and we're going to get you what we need. I hate to leave this conversation. It's so great. But I think we should probably move on and close up so people can go back to their work. Evelyn, there we go.
We'll keep this brief. Just so much awesome information today. We're just encouraging you to think about if there's a small goal to set between now and the next time we meet together about putting some of it into practice. Next slide, please. So our key takeaways today, really keeping the vocabulary, keep it simple. I think that that's always easier said than done. So hearing the examples from Leah and Monica about what that looks like and the incredible power that has. So encouraging that takeaway, understanding the demographics of your community lead to better partnerships. And then also the awareness of partners must have and can't do's. Save a lot of headaches. So really appreciate those takeaways from our partners today. Next slide, please. We'll share all the resources. We'd love to hear other resources that our partners and participants have. So keep us posted if you have other resources to add to this list. Next slide, please.
Okay, well, thank you
So
to
excited about this
Art.
next one. So sorry, I'm jumping in on Christy, but if I could fix anything, I would fix transportation and housing. When we talk about what our families struggle with. And so really excited to have this next session about neighborhood and built community. Every single one of these things is hard, but every single one of these things is solvable. It just takes creative thinking and simplicity. Sometimes I think people think I'm not the brightest person because I think we got to talk in the simplest terms possible because that's where the solutions lie. Sorry to interrupt. The next slide, I think that's it. Is it right, Christy?
This is the last one. Yeah, we will see everybody next month. We will send follow-up materials to your email with the slides and all of the resource links that have been put in the chat. So don't worry, those will be sent out to you as well. We'll also send the certificates of attendance for the sessions October through December. Those will be emailed. Please just give us a little bit of time to process those. And then we look forward to seeing you next year. I can't believe we're at the end of the year. We look forward to seeing you in January on the 16th. And thanks everyone for joining us. Have a great rest of your day.